Hello YouTube, I'm Dr. Fox. Today, I'd like to talk about ejaculation problems. Sexual problems in men often concern ejaculation, in particular premature, delayed, or retrograde ejaculation. Anyone who is suffering from continued ejaculation problems should see a doctor. You can have an open discussion with your doctor about your problems, and they might provide you with a referral to a specialist or conduct their own examination. Okay, first, what is premature ejaculation? The most widespread ejaculation issue is premature ejaculation, which is where a male ejaculates too fast when having sex. According to a study that examined hundreds of couples in 5 countries, the average time it takes to ejaculate when having sexual intercourse is approximately 5.5 minutes. However, every couple is different and needs to decide what works for them. There is no set time that sexual intercourse should last. It is common for men to experience premature ejaculation issues from time to time, and occasionally problems shouldn't worry you. But if you are ejaculating prematurely around half the time, then you may wish to make an appointment with your doctor. Then, what causes premature ejaculation? There are several physical and mental issues that can cause premature ejaculation. Physical causes may be problems with the prostate, having an under or overactive thyroid gland, or the use of recreational drugs. Mental or psychological causes may be things like stress and depression, issues in your relationship, and worry about your sexual performance, especially at the beginning of a new romantic relationship, or if you have a history of ejaculation problems. Occasionally, a man will have always had issues with premature ejaculation. If you have had these issues since you first started having sex, it may be linked to a number of things. For example, it may be the result of conditioning, that is, your early experiences with sex can impact your future sexual experiences. If a boy practices ejaculating quickly so he doesn't get caught masturbating, this could become a behavior that is difficult to change in adulthood. Also, sexual trauma in childhood may be a cause, which can include serious sexual abuse or simply embarrassment from having someone walk in on you when you are masturbating. You may also have been brought up in a household with strict ideas about sex. Finally, there could be biological causes. The sensitivity of the penis is different for different men, and some penises can be highly sensitive. Okay, next. How do you treat premature ejaculation? Your doctor may be able to help, but there is a lot you can try at home first. Some men find it helpful to masturbate 1 or 2 hours before they have sex. Use a thick condom to decrease sensation. Briefly stop the automatic ejaculation reflex your body experiences when ejaculating by taking a deep inhalation of breath. Have their partner or top during sex so their partner can stop or move away when they are nearing ejaculation. Stop at points during sex. Think about something dull and unsexy when having sex. If you have been with your partner for a while, couples therapy may be another option. In couples therapy, your therapist will encourage you to discuss any problems in your relationship and will help you to try and resolve them. Your therapist can also help you to break the habit of ejaculating prematurely using techniques such as a squeeze technique and a stop-go technique. The squeeze technique involves your partner masturbating you, but stopping before you ejaculate and then squeezing the head of the penis for 10 to 20 seconds. After this, they wait for half a minute and then start masturbating you again. This process can be repeated a number of times before you finally ejaculate. In the stop-go technique, your partner masturbates you and then stops, but without squeezing your penis. Both of these techniques appear simple, but they take practice. When you feel more confident in your ability to delay ejaculating, then you can start to have sexual intercourse and stop and start as needed. In terms of medical options, antidepressants, especially SSRIs, can be helpful. They are intended prematurely as a treatment for depression, but can help men to delay ejaculation. Typically, you will need to be on SSRIs for a week or two before you see the full benefits, but some men will see an improvement immediately. Moreover, SSRIs generally have only mild side effects, but should go away after 2 or 3 weeks. The most common side effects are tiredness, nausea and vomiting, diarrhea and sweating a lot. Also, typical anesthetics like lidocaine may be helpful, but they can be transferred to your partner's vagina and reduce their sensation also. Finally, the simple condom can help treat premature ejaculation, especially when it is used alongside a local anesthetic. Okay, next, what is delayed ejaculation? Another common ejaculation problem is delayed ejaculation or male orgasmic disorder, which occurs when the male experiences a long delay before ejaculating or cannot ejaculate despite wanting to and having a normal erection. You could be suffering from delayed ejaculation if you find that you have unwanted or repeated delays lasting half an hour to an hour before ejaculating, or if you can ejaculate only half the times you have sexual intercourse or less. Then, what causes delayed ejaculation? As with premature ejaculation, both physical and mental issues can cause delayed ejaculation. Physical problems such as type 1 diabetes, injuries of the spinal cord, multiple sclerosis, advancing age and prostate gland or bladder surgery can all cause delayed ejaculation. The mental or psychological causes of delayed ejaculation are the same as those for premature ejaculation. For example, stress, depression, a history of sexual trauma, and so on. Additionally, a large number of medications can cause this ejaculation issue, such as antidepressants, especially SSRIs, antipsychotics, beta blockers, and other medications for high blood pressure, muscle relaxants, including baclofen, which is a common treatment for multiple sclerosis and motor neuron disease, and methadone, often used to treat heroin addiction, and other potent painkillers. Some men will always have suffered from delayed ejaculation, but it is more common for this condition to come on suddenly and without warning. You may find that you suffer from delayed ejaculation all the time or only in specific sexual situations. Perhaps you experience delayed ejaculation when you have sexual intercourse, but not when you masturbate. There is typically a psychological reason for delayed ejaculation when it only happens sometimes. Okay then, how do you treat delayed ejaculation? One way to treat delayed ejaculation is with sex therapy, which is a type of counseling involving psychotherapy and making changes to your sexual habits. Sex therapy can help you to enjoy sex more and ejaculate more easily. At a sex therapy session, you will be able to discuss anything you wish about your relationships, sex life, and sexuality free from any judgment. While a sex therapist should never ask you to do anything sexual in a session, they may recommend some activities to try at home. For example, your therapist may suggest that you watch erotic movies or look at erotic magazines before you have sex to increase your excitement. Introduce sex games and fantasizing into sex. Use a lubricant to make intercourse more comfortable. Use sex toys like vibrators or boost stimulation. As SSRIs can cause delayed ejaculation, it may be worth changing your medication to see if a different medication will stop the problem. Abusing alcohol and taking illegal drugs can also both cause delayed ejaculation. So stopping these activities can be an effective treatment. Okay then, finally, what is retrograde ejaculation? This ejaculation problem is quite rare. Retrograde ejaculation is when semen does not travel out the tube that you pass urine through, but instead travels in the opposite direction and into the man's bladder. You may have retrograde ejaculation if you don't produce any or only a little bit of semen when you ejaculate, or if your urine is cloudy after you have sex. It will be cloudy because there will be semen in the urine. Retrograde ejaculation is not dangerous to your health, and men with this condition will still be able to orgasm, but it can affect male fertility and make it more difficult for men to make someone pregnant. Okay then, what causes retrograde ejaculation? Unlike premature and delayed ejaculation, the cause of retrograde ejaculation is purely physical. Retrograde ejaculation occurs when the muscles or nerves around the spot where the urethra and bladder connect, known as the neck of the bladder, are damaged. When men ejaculate, semen cannot enter the bladder because the neck closes tightly when they orgasm, and so the semen travels out of the urethra. If the nerves or muscles around the neck of the bladder are damaged, then the neck may stay open and the semen can then travel to the bladder instead of out of the urethra. Damage to these muscles is most often the result of bladder or prostate gland surgery, but it can also be caused by multiple sclerosis, diabetes, and alpha blockers, which are medicines gradually used for high blood pressure. Okay then, how do you treat retrograde ejaculation? Men with retrograde ejaculation can still have a normal sex life and the condition has no negative health effects, so treatment may not be necessary. However, if you're suffering from retrograde ejaculation and want to have a child, there are some medical options. As with delayed ejaculation, pseudoephedrine can be useful if the condition is the result of surgery or diabetes. When using a particular medication has caused retrograde ejaculation, simply stopping this medication will usually stop the problem, but don't stop any medication before talking to your doctor. Unfortunately, in situations where retrograde ejaculation is the result of severe nerve or muscle damage, it may not be treatable. If treatment isn't possible, men who want kids can have the sperm in their urine removed and used for IVF or in vitro fertilization or artificial insemination. Okay, lastly, it is usually a good idea to get your partner involved if you're having issues with sex and are looking to start treatment. In fact, simply discussing your worries and struggles with your partner can help to solve the problems you're experiencing. This also gives your partner the chance to discuss anything that is bothering them and maybe contributing to ejaculation issues such as difficulty climaxing through intercourse alone. Okay, thank you for watching. See you soon.